All right, look, the Viagra ads are everywhere. Cialis tells us that we should only bathe in adjoining bathtubs. I never understood that. But this subject is a real problem for millions and millions of men and an equal number of women. Okay? Because if daddy's works aren't working, then mama's not happy either. Isn't that generally true?
Well, mama's not happy, nobody's happy.
Dr. Angela DeRosa, you know what? I couldn't think of anybody better to ask these questions of. You are the authority on all things, including erectile dysfunction. Now, the marketing device that just seems to me to be an ad man's dream is, and if the erection lasts 4 hours, call your doctor. The minute I heard that the first time, I thought, brilliant. That's brilliant. Planting the idea that it could last 4 hours.
That it's a possibility.
Is it a possibility?
It is a possibility.
And is it dangerous?
It is very dangerous, actually. If you take these drugs and your erections do last longer than 4 hours, you actually risk losing the appendage. So it's not a pretty thing, and most men would not want to consider it. Although it's fun and games to talk about it, it can be a very dangerous scenario.
I'll take a chance on my eyesight. A number of Catholic boys will say, but I don't want to lose the whole thing. Why is it that some men, all too many men, can't perform?
Well, as we get older, there's certain things that we've done to our bodies to damage the blood flow that actually goes into the penis.
Like what?
Smoking is bad for anabolic steroid use, can be certainly problematic. Environmental exposures, poor diet, developing high blood pressure, diabetes, heart disease. So there's all these things that contribute to lowering the blood flow that enters into the penis, which will lead to erectile dysfunction.
Yeah, but is some of the problem from the neck up? I continue to hear that.
Well, you know, it's interesting. With women, it's generally the neck up. We have problems with low desire, so the brain doesn't function right. Most men, not all, but most men actually have the desire, but their plumbing doesn't agree with them. So those are usually blood flow problems, or biggest cause, testosterone deficiency.
But you know, there's an awful lot of guys, and it's a guy problem anyway, because the minute that happens, of course, he instantly has to say, this has never happened to me before.
Oh, of course, and it never did happen before, did it?
But,
No.
but he also is concerned, I guess, from the time that he goes through puberty. Is it a problem with a lack of masculinity?
Absolutely.
Is it a problem with a lack of virility? Is it a problem just with a lack of passion?
Well, for men, again, they're very visual creatures, so they need to be erotically stimulated, which most men, if given the right scenarios, will definitely get there. But you're right, if they start to have any issues whatsoever, they start to get inside of their head, and then the plumbing doesn't even work, because now they're psychologically having trouble with that. But what drives it in the first place is usually a medical problem. So, but let's take out the rare circumstance where maybe you've been out drinking too much and then things just don't work right.
That's
usually
a problem too.
an alcohol problem. However, there are some genetic predilections to that. Some men actually have what's called estrogen excess, where they convert too much of their testosterone to estrogen, and those guys may suffer from erectile dysfunction earlier on. Or there's a disease called Peyronie's disease, where there's a collagen problem where they can't actually get erections properly, where it's actually a bunch of scar tissue.
Yeah.
But most often it's a disease of chronic blood flow problems like the hypertension, diabetes, etc.
And one of the biggest problems of all is people don't talk about it, particularly
Men,
guys.
no. I can get women to get in a group and talk about their low libido any day of the week. For men, we actually tried to host a happy hour for them to discuss it. We got 0 calls.
Because you called it a happy hour.
It's not necessarily happy.
No.
But men don't want to talk about their lack of erections in front of other men.
It is a symbol of failure.
Well,
right?
Failure and also lack of masculinity and virility, as you said.
Okay, what about the chemical solution? What about all of the ads we're bombarded with that this is the solution?
Well, not every solution is going to fit for every man. The first thing you need to look at is hormonal imbalances. Do they indeed have estrogen excess? Are they testosterone deficient? Those are the foundation that we need to create to make sure those are functioning. You can give Viagra, Cialis, and if you don't have proper testosterone and you have too much estrogen, they're not going to work. But once we establish that the hormones are balanced properly, and now we're dealing with the blood flow problem, that's where the Cialises and Viagras and the Stendras all work beautifully, because they increase and enhance blood flow. And if we get to that point where just too much damage is done to the blood flow, then there's other things where we can inject gels into the penis that actually will dilate.
You just lost the audience.
I know, inject.
You just heard thousands of men across Arizona inject what into the penis? I think I'm going to watch this other channel. Okay, is that what you brought here, these props?
Yeah, so in other words, so not only
You
can
don't mind if I back up?
Oh, no, there will be no injecting you
what?
today. So there's a couple things. Number one, you can have a gel that can be injected into the urethra that can vasodilate the penis. It doesn't hurt at all, but the next step after that is actually injecting a needle into the penis that actually will work even better. But most guys are very, very, I guess, a little freaked out by a needle near their penis.
If there is anything in the world that would create erectile dysfunction, it's a doctor looking at you and saying, we can take care of that. Here, drop your pants. I got a needle.
No, but look at it this way. If they've exhausted all other causes,
Yeah.
then certainly they may take that consideration.
What is this?
These are samples of the Cialis. Once again, these drugs work great to dilate blood vessels if there's a blood flow problem. But always, always check your hormones at baseline, because these won't work as well or at all with those not working.
And do people still use those pumps?
They do. There, as men, we joke a lot about it, and this can be a very funny disorder, but it can be very serious when you inhibit that intimacy between a partnership. It separates us from being roommates and just best friends.
Who thinks it's funny?
Well, the public does. We talk about erectile dysfunction, and it's a joke on constant TV.
I don't
meetings.
imagine that the guy who has the problem ever laughs.
It is not a joke. It
All right, so
is not.
what do you recommend we look at first? The hormonal deficiency?
Look at hormone deficiencies, look at cardiovascular risk factors, because erectile dysfunction not only is a sexual problem, but it's an indicator that there's also cardiovascular disease problems that we need to deal with. So checking hormones, doing a good cardiovascular review, then looking at possible medications that can then aid if not dealt with hormones.
Yes, and you know, it's way down the list. Dr. DeRosa says, well, yeah, the needle is a possibility, but it's far, far down the list. Aren't you glad you watched the Morning Scramble today? And you know what? You're not going to change your mind, because Lisa's up next with Chow.